Yes, and we're back here in What's Up, of course, together with me is my beautiful co-host, no other than Dr. Glaiza Dapal. And our topic for this afternoon is all about scoliosis. Is there any solution? And that's the question.
Very good
And
question.
we have a very interesting guest, and who are, I can say, one of the pioneers in the gadgets for treatment of scoliosis. Is it a prevention or is it a treatment? So that will be another question for Dr. Fong. Dr. Fong, you have this what we call spine core. Okay,
Yes.
is this spine core is for treatment or prevention?
It depends on what stage of growth the child is or the patient. So for adults, it's predominantly and targeted for pain management, and it's also for postural or structural stability.
Okay.
But for children, if they haven't hit growth spur, it is actually more of your objective is for either corrective or stabilization or to slow the scoliosis down. But if the patient is going through rapid growth rate, you can't stop it, but at least you can provide almost like a break to try and slow it down or to keep it
There was
managed.
a hanging question.
Yes, there's actually a hanging. Actually, we have another
Maybe,
question,
yeah,
Dr.
maybe later.
Seneca.
Yung hanging question muna natin.
Yes.
Oo. Is there any diagnostic tool?
Yes,
that,
Yes, diagnostic tools.
could
Scoliosis.
tell you that, hey, I have scoliosis, or the doctor will tell you you have
So
scoliosis.
the way to diagnose scoliosis is usually we always recommend patients go and see your doctor. So the doctors will be trained on all the different ways of assessing scoliosis. So one is the clinical test, the postural. They have a tool called the scoliometer, which the patient bends forward, and they call it the Adams test. Unfortunately, the Adams test is not always accurate because you can have a true
Adams
positive
test.
Adams test.
So how do you do that?
That's where the patient actually bends forward with
Okay.
their hands clasped together,
Yes.
Okay.
and then they bend down with the hands between the knee,
Uh-huh.
and then the practitioner will look at the ribs and see which one is more prominent.
Okay.
But the problem is you can have either true positive or false negative.
Okay.
So sometimes someone can have scoliosis, and when they bend forward, the spine straightens up perfectly.
In short, it depends upon the
on
examiner's
the examiner,
observation.
that's right.
Also.
So we always recommend that they do need to get an X-ray done, because the way they present doesn't always represent what their spine looks like.
So it's very
So-
simple, just an X-ray, huh?
An X-ray, yeah.
What
but,
view of the X-ray are you gonna request?
usually the most important view are usually two views, which is either so you do need a full spine from the back
Full
and
spine.
full spine from the side. If the patient is indicated for surgery, sometimes the orthopedic surgeon may request X-rays bending to the side, left side, right side, or they may actually request supine. But the most important are the first two, just from the back, from the side. Yeah.
Oh,
In
okay.
terms of the age,
Yes.
we're talking about the adults and the pediatric patients. I'm just wondering what is actually the limit
The
of
limit.
the age, the age
Yeah.
bracket for the
The youngest patient that we have here is about 5 years old. In Indonesia, we have it 4 years old. The oldest we have is up to 90, 95 years old.
Wow, really?
Yes.
Uh-huh.
Yeah, so
Is there still a treatment for, let's say, if you're on that age
In
bracket,
that age
at
bracket?
9 years old?
when
Do you
you're
have any cases
yeah,
you've been treated?
when you're quite elderly, the brace is not designed to try and change the scoliosis. It's virtually almost impossible because you have so much degeneration. But however, it is actually more for pain management or to provide stability for the spine.
What does the cause of the pain in scoliosis?
In scoliosis. And it comes from many things. In some cases, it could be overstretching, weakening of the soft tissue structure. Sometimes you can have disc degeneration or disc bulges. Sometimes you may have what we call olisthi or listhesis. The spine can actually slide to one side or to the front, severe rotation. There may be nerve irritation. But however, there's been studies showing that you can have nerve compression and you have no symptoms.
Right, right.
And,
Nerve compression.
Dr. Fong, it seems,
yeah.
Dr. Seneca,
Yes.
it seems that our televiewers are actually very interested with
Interested.
our topic.
We have a texter from cell phone number 2814 from Marley de Guzman of Cavite. Yes,
The
doctor.
question is, you said that spine core is proven. Are there testimonials and some before and after
After
pictures of your
They-
patient?
They're asking for any testimonials of patient.
Yes.
But maybe I could ask Miss Amy here, because you've been, how long have you been in the
This
spine core? Or
2 years, going to 2 years, Doc.
Yes, and then how many did you have a lot of patients? I mean, in terms of the
Yes, of course, Doc.
Yes.
statistics that spine core had. You know.
From March 8, 2016, when we started, and up to now, we have 200 patient brace.
Braces. that you sold out all over the Philippines.
Yes.
Did you sell this directly to the patient, or you sell it to the doctors?
Yeah, it's usually the doctors who do the assessment evaluation.
Yes, correct.
Then they will give us the measurements and we send it out to them. So
So you have to do some measurement then.
the
It's
doctors
very
has to do that.
important.
Yes.
Through X-rays.
Two X-rays and
Through
also
X-ray.
the patient's body size, the flexibility.
Okay.
So the practitioner will then have to do the assessment and give us the measurement. There's about 12 different
So
measurements.
you
we
get to
require.
do a lot of what you say meetings and trainings, especially for the doctors,
Doctors.
let's say
Yes.
orthopedic surgeons, maybe
yes.
family medicine doctors,
Yeah.
and then you teach them how to wear these gadgets,
Yes.
and then plus the measurement. Is
Yes.
that right?
As a matter of fact, the doctors this week have just undergone the training. So we usually come back every 3 months or so to reevaluate.
Correct.
And we were just mentioning earlier that it is available in Philippine Orthopedic Center, St. Luke's,
Really?
Global, and St. Luke's, Quezon City. We also have it in Dapal. So it's there's more and more hospitals and
Yes.
clinics that's actually beginning to have this now.
We're actually slowly expanding,
Expanding.
introducing the product.
That's right.
We have here, we're actually going to show it
Yeah,
already.
probably yes.
The brace that we're talking about
Yes.
all throughout this segment. Can you elaborate, Dr.
Sure.
Fong?
With the brace, we have two components. We have the lower part and the upper part.
Okay.
So the lower part will be made of this the shorts.
Yes.
So this is made of lycra material, and the shorts are measured to the millimeter. So when
So
we
is that depends upon the how much is your waist
that's right. The measurements.
Measurement.
and
Yeah.
you have to do that, right?
That's
You
right.
see it,
That's right. So the doctors will give us an idea what is the pelvic size. So from there, this will be made of this. There's a belt, so
Okay.
this will wrap around the pelvis to provide stability. So
Okay.
that's actually where the elasticized bands will attach onto, and that
So it
becomes
will
the
be on
foundation.
the butt area.
From the lower back all the way across the buttock to the front area, so it wraps around.
It's
yes.
wrapped around.
Is it
Yes.
medyo? Is it because when you wrap this gadget, I mean, of
Yes.
course you're wearing pants or
Yes.
and they will see the marks of the.
It's
of the gadget.
actually quite discreet.
Okay.
We have a lot of photos where patients are wearing it, even with leggings, or they go to aerobics classes
Yes.
or Zumba.
Probably we
and
It
can.
won't
oh,
cause
okay.
bulging.
you can see it, yeah.
Bulging, yeah.
And
Yeah.
while
we
touching
probably-
it, it's very comfortable.
It's
Can we
yes.
can we do the demonstration?
Sure.
Okay.
Okay.
You can put the mic there. Okay.
So,
Oh, then the mic.
so with this, we have the lower portion,
Okay.
and thank you. Yeah. So this will wrap around the pelvic area
Okay.
to the front, and so from here, we would look at the level which is desired, and then we put that on, and then this will be tightened.
Miss, I mean, is it comfortable? Have you tried
Yes,
it?
flexible po ang ating product.
This
Okay.
Doctor, you're natural. Would you like to learn
You
how
can
to do
do
this?
sports.
So
while-
yeah,
while
So
using
you're doing
brace.
sports,
Yes.
I can be part of the corporation.
You're a natural.
Yeah.
So this would be the foundation.
Okay.
So after they've done that, there will be measurements for the upper body. So that would be the chest size and also measurement from T1 to the tailbone,
Okay.
and then from T4 to T12.
Okay.
Yep, so that will give us an idea what size we require for the upper part.
Okay.
So for the upper part, you will have this. This is known as the bolero. So the bolero will be dependent on the patient size as well.
Okay.
And then, oops, sorry. So this will wrap around through the armpit.
Okay. It's like
So
a shirt,
this-
huh?
Like a shirt.
So this is the bolero type.
This is the bolero
Okay.
type. That's right. So this is actually the third generation of spine core. So they've gone through many different versions.
Is it comfortable when you wear that?
It's actually quite comfortable. Some
And-
patients actually wear the pants as
Okay.
an underwear.
All right.
Because,
Oh.
so they will replace the underwear.
Yeah, the
So
feel of it,
excellent.
it's actually very smooth.
It
Yes.
is.
In
terms
So
of its
it's,
texture.
Lycra, cotton,
Okay.
yeah. And then from here we have, depending on your scoliosis, as there are 27 different classifications for scoliosis,
Okay.
each of them have a very specific way of being applied. So you may have the band attached from here to maybe say wrap around the lower back to this side, and then the other band might attach to this side, another band from the shoulder down to the lower back or the front. So there's many different configurations on how we can actually, thank you. So there's many different configurations on how we apply the bands, how much resistance, what is the what we call corrective movement, how much pressure, how much translation,
Okay.
how much rotation
So
that you're trying to
do
achieve.
you need help? Well, let's say if I want to have one of these, is it complicated for a patient to wear the
Ah.
spine cord?
It's actually quite easy actually, because one of the things we do is that the practitioner will fit it first, and then they will take the measurements, they will trim it down to size. So everything is bespoke, so it's customized.
Okay.
Yes.
How long should the patient wear the
Yeah,
brace?
If they're a child, they'll normally wear this for 20 hours a day.
20
Um,
hours.
But it's not 20 hours straight. So they can wear it for, let's say, 6 hours and 1 or 2 hours off, 8 hours, 1 or 2 hours off. And it's a minimum program of 18 to 24 months. But
18
if
to
you
24
18
months.
to 24, but if you're an adult, you actually wear this about 2 to 3 times a week, 6 to 10 hours a day.
Oh,
So
so
if you-
it's not 24 hours a day, huh?
Never, never.
Okay, okay.
Yeah, because
3 to 4. I just want to make clear of that for the televiewers. Is
Yes.
3 to 4 times
a
week.
week.
Yes.
Yeah.
a week. Oh,
But
it's
that's
not bad.
for adult.
Yeah.
But they can wear it up to a maximum of 20 hours.
But in terms of activities, are there
Yes.
any limitations while you're wearing the brace?
Ah.
Like if you want to do your
Yeah.
strenuous activities,
Yeah.
is it okay?
The good thing about this is that we do encourage patients that while you're exercising or active, wear this.
Oh.
So we have patients who
Like
are
say
hip hop.
Zumba, no?
Yes, exactly. Yes.
Yeah.
So we have patients
Everybody's
who
doing
are
that.
Yes.
ballerinas, gymnasts, Muay Thai, MMA. We have hip hop dancers, gymnasts. They actually wear this while they're exercising.
Yes.
So it doesn't cause any restriction or limitations.
Any recommended exercise? Well, let's say when you wear the spine core, do you recommend any form of exercise or standard exercise or what positioning while wearing that?
With this one here, the spine cord actually does have its own exercises to target the different types of curves, but you can do things like actually any kind of physical activities while you're wearing the brace. So it will
Okay.
not only provide resistance, but stability to your spine while you're exercising. So the aim is to achieve symmetry and strength.
Miss Aimee, hindi ba mainit to? I mean, have you tried wearing this? Of course, for prevention of scoliosis.
No,
Mainit ba? Is it hot? I mean, is it comfortable?
from our patient itself, they are very comfortable to use it, and they can do sports while
We're doing that. We're
Yes.
using that. Okay. Okay. Now we have. Oh no, wala. So later on, I will. We have another texter from Marikina. Okay, from May Gibara of Marikina, Doctora.
The spine cord treats congenital kyphosis.
Kyphosis.
Okay, with kyphosis, so besides looking at the spine from the back and the different curves,
Right.
hunching or hyperkyphosis or is also another type of, is an indicator. So, but once again, we have to ascertain what's causing the scoliosis or the hyperkyphosis.
Yes.
If the person has a hemivertebra or congenital deformity, then no. If they have things like cerebral palsy or some sort of connective tissue problem, then the brace is not indicated.
But we'd just like to clear it to our televiewers. Does the brace target the spine itself, or it targets the muscles?
muscles.
It targets the nerves.
Just because
Which part
just
of
last time we had a guest who is from Korea,
Yes.
and he's trying to present the, like different gadgets, no? For also for the back, and he's targeting naman the muscles,
muscles.
of the body, and he has a very good points also regarding scoliosis or any other back problems. And you know, yours naman is you're targeting directly the spine.
All three actually.
all three.
All three.
because,
The muscles, the
yeah,
spine, and
Because the fundamental research have shown that if you have scoliosis, it is a muscular issue,
Yes.
it's a nerve issue, and it's a bony issue.
okay.
So the way this works is it targets all three at the same time.
Oh,
Which
okay.
is very, very excellent.
Which
Targeting
is
all three.
All three.
How about
And-
your success rate in treating scoliosis?
Based on research and based on what our providers are using, a lot of them are rehabilitation specialists. And this is not just over here, but worldwide. It has been shown to be 89% effective. But once again, it's also case by case. In some circumstances, our aim is not to try and reduce the curve or to try and correct the scoliosis. In some cases, you are actually providing support There are cases where, let's say, a patient may require surgery, and the orthopedic surgeon may decide to postpone the surgery. And if they don't do anything, there's nothing holding the spine, it can actually deteriorate. So some of the orthopedic surgeons will refer the patient to get bracing,
Okay.
so just to keep it under control before the date of the surgery.
Sige.
For Miss Aimee,
Aimee, yeah.
I'd just like to ask, where can our patients or where can our viewers find the brace?
I mean,
I'm
where
sure a
can
lot
they
of
buy?
them-
You can buy it directly to the doctors,
Yes.
or prescribed doctors, or probably directly from the. Maybe later on we'll give your
Yes,
contact
yes, yes.
details regarding where you can buy that. And you know the problem is that of course you have to wear it every day, right? And do you have to buy like 2 or 3 pieces or 3 sets of the braces, and or is that washable?
Yes, it
I mean,
is.
is that washable through washing machine, or you have to have a
it's
special
cleaning
washing
instructions,
training? Yeah.
It actually comes with 2 shots, so you can interchange between this one and that one, so alternating days. The top one we usually recommend wear like a shirt or bodysuit underneath it,
Okay.
so you can absorb all the sweat.
Right.
To wash it, it's just like normal clothing. Yes.
Yeah, it's okay. Yeah. I do that also.
I guess it's because of
Yes,
the change of the weather.
But you know, how about that? Yun nga yung question ni Doktora. Let's say if I want to buy now, of course we will later on we will
Contact numbers. We will
contact
give you
numbers.
our
I mean,
contact numbers.
is there any only one store or center here in the Philippines that you can buy the products?
Our office located at 202 Jat Building, National Highway, Barangay Platero, Binyan, Laguna.
Binyan, Laguna pa.
Yes,
Okay.
yes.
So far.
Any contact numbers?
0905-578-6616.
Okay. Dahan-dahan lang pa. Maraming siguradong tatawag sa
Gustong
inyo.
bumili niyan,
Oo.
Dr.
Yes,
Cenica.
You can contact us, please, at 0905-578-6616.
Is it available online or not
Yeah.
yet?
Do you have any website or
Yes,
Facebook?
we have our website.
It's www.ScolioCareCorporation.com. But the product cannot be purchased like an online sort of a clothing
Yeah.
as such. It has to be, you have to have seen a spine cord provider
Yes,
first.
of course.
But if you want, say, spare
you
parts
have
or
to
components,
have
we
like
can.
an accredited spine core providers.
Absolutely.
And
yes.
it's very important. Thank you very much. And you know, our time is so fast. No, it's
Even
like
if we have a lot of texters.
a lot of texters. So the winner for
Thank
our
you
gift
so much.
certificate is Miss Marilyn de Guzman. You won a 2,000 worth of gift certificate, and you can claim it here in Global News Network or at Janssen Cosmetic Surgery. The cell phone number is 0917-528-7897. And you can also call landline at 521-1444. Thank you very much, Dr. Fong.
Thank you.
Thank you
It's
very
been a
much,
pleasure.
Aimee.
Thank you po.
And yes, Doctora.
Thank you very
Thank you very
much,
much.
Dr. Fong, Miss Aimee.
Thank you po.
We had a very interesting topic, but we had to
Yes.
cut it short. I'm just inviting everyone to please visit Janssen Cosmetic or Mita, Manila.
Janssen Cosmetic Surgery. You can log on also at www.janssencosmeticsurgery.com. And our telephone number is 521-1444. We have also a Pampanga branch at Angeles, Pampanga with Dr. Buddy Kililan. And you can also watch this replay tomorrow, Sunday, 1 to 2 o'clock. I think Saturday, Tuesday and Thursday, we have a replay between 7 o'clock to 8 o'clock. And we'd like to probably invite you again if you have any other new products of Spine Core.
Thank you so much.
And
Thank
we'll
you,
be
yes.
here for especially our televiewers who are well educated regarding the problem of scoliosis. Again, this is Dr. John Cenica for another episode of What's Up, Doc?